Lyme disease and dog arthritis. Lyme disease, also called Lyme borreliosis, is a tick-borne disease in the northern hemisphere. The infectious disease is caused by 3 species of bacteria: Borrelia burgdorferi sensu stricto, that's the U.S. cases, Borrelia afzelii, European cases, and Borrelia garinii, European cases. The name of the disease comes from Lyme, Connecticut, USA, when in 1975 a small outbreak affected the town. Lyme disease is transmitted to human via tick bites, more specifically a tick named Ixodes scapularis, or more commonly referred to as the deer tick. For people, the early symptoms include fever, headache, fatigue, and a characteristic circular skin rash called erythema migrans. This circular spot is often referred to as a bullseye. Lyme disease should not be left untreated, as it can affect the joints, heart, and the nervous system. Nonetheless, once diagnosed, it is fairly easy to treat with the administration of appropriate antibiotics. The commonly used antibiotic for the treatment of Lyme disease is doxycycline. Lyme disease in dogs. Due to increases in the population of deer, many regions have seen an increase in the prevalence of Lyme disease. Some of the hardest hit have been domestic dogs, considering that the female tick will feed on any warm-blooded mammal. The male tick usually stays on the host, deer. All dogs living in the upper Midwestern states, the Atlantic seaboard, and the Pacific coastal states are at risk of contracting Lyme disease. The infection only sets in when the parasite has been attached to the dog for at least 18 hours. The most common symptoms of Lyme disease are often similar to dog arthritis. In fact, the infection and the late treatment of it can lead to the development of dog arthritis. That is why dog owners should be wary of the following symptoms: loss of appetite, fever and lethargy, enlargement of the lymph nodes, recurrent lameness of the limbs due to inflammation of the joints, weight-shifting lameness, where the dogs are lame on one leg one day and then shifts to another leg another day. When you observe any of these symptoms in your dog, it is recommended that your pet be examined by your vet immediately. A simple blood test can be taken to identify the disease. If the examination and the blood test reveal that your dog is infected with Lyme disease, your vet will most likely prescribe the necessary antibiotics. Improvement usually occurs within 24 to 48 hours after starting antibiotic therapy. Just like in humans, when Lyme disease is left untreated in dogs, the infection can cause nervous system complications, heart problems, and even kidney failure. Lyme disease is easy to treat. However, it is easier to prevent. As a dog owner, you have an important role in protecting your dog from Lyme disease. Currently, there are vaccines available to prevent infection and have been proven to be approximately 80% effective. In addition to vaccinations, establishing a monthly routine habit of applying one of the proven veterinary flea and tick preventatives, such as Frontline or Advantix, will increase your chances of preventing this disease. Also, taking precautions to avoid tick-infested environments during the most common periods of tick activity, which is spring and fall, will help in your overall goal of preventing exposure.